Can constipation cause recurrent UTIs in children? Imagine feeling uncomfortable and needing to go to the bathroom often. Sometimes, children with frequent urinary infections also have trouble with their bowel movements. This is because constipation can actually play a role in causing repeated urinary tract infections in kids. Constipation happens when stool builds up in the rectum and colon, which can press against the bladder and urethra. This pressure can make it harder for the bladder to empty completely. When the bladder doesn't empty fully, residual urine stays behind, creating a perfect environment for bacteria to grow and cause infections. Children who are constipated may also have trouble sensing when their bladder is full, leading to less frequent urination. This can make bacteria more likely to multiply and cause infections. Research shows that children between the ages of 4 and 18, especially girls, often experience this link. Nearly half of children with severe urinary infections, called pyelonephritis, also have constipation. Kids with constipation are more likely to have recurring urinary infections compared to those without constipation. When doctors treat constipation, many children see a reduction or even a disappearance of their urinary infections. This highlights how important it is to manage bowel health as part of preventing urinary infections. Constipation can also cause abnormal bladder function. For example, children with constipation often have increased urine left in the bladder after urination, which raises the risk of infections. It can also lead to bladder and bowel dysfunction, a condition that makes children more prone to urinary tract infections and incontinence. When constipation is treated with dietary changes, more fluids, or sometimes stool softeners or laxatives, bladder function can improve. This can help reduce urinary symptoms and even help resolve issues like vesicoureteral reflux, which is when urine flows backward from the bladder to the kidneys and can cause infections. In summary, constipation is a common and changeable factor that can lead to recurrent urinary tract infections in children. It does this by interfering with normal bladder emptying and urinary tract health. Addressing constipation through healthy eating, proper hydration, and medical guidance can be a key step in preventing repeated infections. If a child has frequent urinary infections, it's very important to see a healthcare professional who can evaluate bowel habits and help develop a personalized plan. Remember, every child is different, and proper medical advice is essential to keep them healthy and infection-free.